Deuk Spine Institute. It is November 20th, 2025. I'm Dr. Deukmedjian. This is live surgery being streamed. Our patient is from Florida, and she has had back pain now for 30 years. You can see she's had other procedures done like laminectomy and discectomy and spinal cord stimulators. She actually has a spinal cord stimulator, and let's show you the picture there on the x-ray. You guys see that? That's a spinal cord stimulator, generator. She says it doesn't work for her and she wants it taken out, but I told her we'll take it out at another procedure, not today. It's better to just focus on what we're doing here. She agreed. Long story short, how many patients with spinal cord stimulators have we seen that still have back pain and need more surgery? This is just another example. Folks, spinal cord stimulators do not work. Doctors are recommending them left and right to every patient that will lay down and get one. Why? Because the truth is, spinal cord stimulators pay the doctor a lot of money in profit to do the stimulators, and that's why they're recommending them. They're not recommending them because they benefit the patient. They're recommending them because they benefit the doctors and the surgery centers and the hospitals that do them. Well, we're not here to benefit hospitals and doctors. We're here to benefit patients. That's what good doctors do. Hey, Pete? All right, so I'm trying to get into the L5-S1 disc. Why? Because this patient has herniated disc at L5-S1 on both sides and a herniated disc at L4-5. She also has scoliosis. You can see right there on the AP view, and you can see the wires of the stimulator. Show us the wires of the stimulator. There you go. So that stimulator was put in by some other doctor who made a lot of money putting it in, but of course it didn't help the patient. Jordan, let's get those two pedicles lined up perfectly. Could you do that for me? It's got to be a WAG issue. Your orbit looks good. We're just navigating into the disc. Shot again. It looked good. Yeah, perfect. So you can see the needle that I'm using to get into the disc, and we're going to do this entire surgery through a 7mm or 1/4 inch incision. Unlike invasive surgery like laminectomy, look at this. Even the spinal cord stimulator required a big incision, something like 3 inches, 4 inches to get that thing in. But Deuk laser disc repair is minimally invasive, and it's the most minimally invasive surgery available in the world. For spine, it's a cure to back and neck pain if you're having it in your lower back or your neck. Yeah, this is a painful disc, that's for sure. All right, let's get one more AP. We're almost in at 5-1, then we'll get 4-5 next because we're doing 4-5-5-1 on the left and 5-1 on the right. All right, good. Looking good so far. Any questions?
At this moment, no current questions.
Then let's share with the audience, Henry, how does a herniated disc cause so much pain in the back?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video how when you have an injury to your disc, it tears the capsule or wall in the back. It's really a ligament that's being torn, a ligament that connects the bone above to the bone below, and it forms a ring around the entire disc called the annular ring or annulus fibrosus, and that annular ring is what holds the nucleus or jelly in place. When you damage the annulus, what happens is the jelly also gets damaged from trauma during that traumatic injury, and that crushes the nucleus or fragments the nucleus next to the tear, and what that does is it causes, it's perfect. It causes fragmentation of the nucleus, which then escapes out through the annular tear. Once escaped into the tear, it stays in there and causes inflammation. All right, great. So far, so good. We're making some progress here. All right. So both of these needles are kind of at the back of the disc at 5-1, and because the disc is so collapsed and scarred, they're having a hard time going in. I'm going to place one more needle on the left at 4-5, and then we're going to go ahead and get into the disc space so we can fix these two discs. The procedure she's having is called the Deuk laser disc repair. It's the most advanced laser endoscopic spine surgery in the world for back pain. There is no surgery in the world that's less invasive and more effective. So if you want minimally invasive and you want effective, this is the procedure. Let's show the audience the 30 different causes of chronic back pain. I'm Dr. Ara Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Welcome back. You guys have just watched the 30 causes of back pain. And it turns out that chronic back pain is the #1 cause for people to go to the doctor. It affects 1 billion people worldwide. And doctors around the world have typically no idea why people have back pain. Many doctors will try to blame the patient, saying the patient's either faking it or it's all in your head. And that really is frustrating for people because they know they have back pain and they're not faking it and it's not in their head. But doctors say that because they can't figure out why people have back pain. Until now, Deuk Spine Institute is the first center in the world to know exactly why everybody has back pain. We can examine a patient with our Deuk Spine exam, which is a patented examination that incorporates diagnostic imaging, history, and physical exam. And we use that Deuk Spine exam to diagnose the source of back pain in each patient that we evaluate. It turns out that the most common cause of back pain is a disc injury, like this patient's disc injury, but it's specifically a tear in the back wall of the disc called the posterior annular tear. And it's not the tear that hurts, it's the inflammation inside that tear that causes horrible, horrible back pain. All right, so this patient has a tear in the back of her disc. As a result, she's having horrible back pain, and the herniations are also pushing out to squeeze her nerves and are causing leg weakness, leg numbness, leg tingling. Now I just did something here very special. Look at that dilator that went in first. That first dilator went in from the right side and it opened the disc space. Look at that disc space. See the white color?
Yes, we do.
That's actually air inside the disc. And the air got sucked in through the little tubes and little holes in the middle of the dilator. But I'm using that first dilator to open the space so I can put the other side dilator in as well. And now I'm going to have dilator in each side, right and left. And I'll be able to get this surgery shot done. Beautiful. So I'm in on both sides at 5-1, the hardest disc to get into. I have a dilator on the right, a dilator on the left, and the reason I was able to do this is #1, I docked the needle at the back of the disc, but I couldn't get into space. But then I had the patient more relaxed. Dr. Berndes, our anesthesiologist, put this patient asleep, nice and deep, so that she relaxed her muscles, because she's got really strong muscles that are clamping down and keeping me out of those discs. But by relaxing her muscles, I'm able to get into this disc easier. So, good anesthesia allows me to do my job of fixing the disc. All right, so we're actually pushing the dilator further in. We don't want to do that shot. Shot. All right, that's good. If we can get this dilator out, that would be great. I don't know if we can. We may need the vice grip. No? Let me see. Let me try it now. So sometimes we have to, we get situations where the patient's disc is just so compressed that it makes it almost impossible to do what we need to do normally, and we have to basically find ways to use the instruments. Go ahead. We're going to try not to crush the dilator. It's too tight. Hold on. Let me do it. So we use a vice grip in times like this. And I'm trying not to crush. There we go. Perfect. So if you set the pressure perfect on this thing, you can actually grab it enough that you can twist out the dilator. Because what's happened is there's a little bit of disc material stuck between the dilator and the tube. Right there. There it is. You guys see this?
Yes, we do.
Right here. Literally right there. That's the culprit. Can you guys see that? Seriously?
Yes, we can.
Where's the blue toe? Right there, a little bit of disc material got between the tube and the dilator and basically welded the two together so that as the dilator went in, as the tube went over the dilator, it grabbed together and it stuck together and both of them went forward. We didn't want both going forward. We only want the tube going forward. She relaxed. Any questions?
We have a comment and a question. This comment is coming from Spicy Irwin on YouTube. Is saying, thank you for all the knowledge of where back pain comes from.
You're welcome. She's perfect for me. You're welcome. That's why we do the live streams, folks. We want the world to know the truth about back pain. And here's why. Yes, back pain's the #1 medical problem in the world, right? But that's not the only issue. The issue is this. This is the biggest issue. And this is why I do what I do at Deuk Spine. This is why I pioneered this company and do all this educational stuff. It's because human beings are suffering needlessly at the hands of providers who are doing treatments that don't work and hurt people. And people are dying needlessly from back pain. Dying and suffering needlessly. And that bothers me. And I can't live knowing that I'm not doing anything to help those people. So I do everything within my power, which is not much, by the way. We're a small company here in Florida. We don't get any government support. We get nothing. And we have to fight the insurance companies to get them to pay. And most of the time they don't pay. So all of our support comes from our patients who pay to have these surgeries done out of their own savings, which they really shouldn't have to pay out of their own savings. The insurance companies should be held accountable for denying treatments to people that are necessary, like this treatment. Thank you. Thank you very much. Yeah, it's wrong. And that's why we do this. We do it because people need to know it's wrong. People need to know we can fix them. People need to change the system so that everybody in the world has access to this treatment. Okay, not just, people with money. Everybody should have access to this advanced treatment and be able to get it done. All right, remember we talked about in our video the inflammation that's happening in the tear? That's it right there, folks. That pink stuff. That is the inflammation. That's what we're here to treat and remove. Once I remove this, her pain from this disc will be gone. Henry, what have we shown so far, video-wise?
We've shown what causes
discogenic
back pain, and then the 30 causes of back pain. We
All
have
right.
not shown
how we fix it.
Yes, correct.
Right.
We have not shown that.
We're going to show you another video now on how we actually cure discogenic back pain, which is disc means the disc, the intervertebral disc or spinal disc. Genesis means to create or originate. Discogenic back pain is back pain coming from a disc. It turns out most patients have 2.5 discs causing their back pain, 2.5 out of 5, by the way. Only 8% of patients have 1 disc causing their back pain. So it's very common for people to have 2 or 3 discs causing their back pain. This patient has 2 at least that are causing her back pain. And I think these two that we're fixing today, L4-5, L5-S1, are the most common discs that get injured and cause back pain, by far. L3-4 represents about 10%. L4-5 and L5-S1 represent 90% of discogenic back pain. 90% of discogenic back pain comes from the L4-5 disc and or the L5-S1 disc. So let's show the audience how we use this laser and the endoscope and minimally invasive spine surgery to cure people's back pain.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. And from our video, you can see that because all of the back pain that people get when they have an injured disc, it comes from a tiny little area in the back of the disc, the posterior annular tear, inflammation happening there. If I go in endoscopically, find that tear, use a laser to clean up the tear and get rid of the herniation, get rid of the inflammation, get rid of the devitalized tissue, we call it, calcified tissue, and just basically the remnants of war that your body's waging on this tear. We get rid of it, clean it up, that your body will heal this tear on its own. You don't need metal in your back. You don't need plastic in your back. You don't need stimulators. Remember, she had surgery on her back. She had a spinal cord stimulator as well. It didn't help her. She wants me to take her spinal cord stimulator out. We have so many people contacting us that have had spinal cord stimulators put in, and they do not work. The only reason doctors are putting them in is because, well, patients are so desperate to get them. We have her moving, Berndes. This is the most painful part of the disc. It's the outer annular tear, and she's definitely feeling pain. We're going to put her more asleep. I'm going to hang on for just a minute while we do that. So basically, spinal cord stimulators are the highest profit earning procedure for pain management doctors. There is nothing they do for a patient that makes them more profit. They can make $10,000, $20,000, $30,000 for each stimulator profit. Now, in the old days, pain management doctors used to do epidural shots and facet shots, and they would make $50, $100 profit per shot, and they made reasonable money. It was a good field. But with the explosion of stimulators that are being promoted by the companies that manufacture stimulators, like Boston Scientific and others, these spinal cord stimulators are being put in left and right for big profits. I've heard of some hospitals and surgery centers where they have 10 or 15 patients that day having stimulators put in, and that center is going to be making millions of dollars in profit every year on your misery and suffering. She's still wiggling around a little bit. Yeah, so when I stopped zapping this tear right here, she stopped moving. So clearly there's a lot of little pain nerve fibers right here that Dr. Berndes is saying she's very sensitive. Okay, well, I need your help, Dr. Berndes. Is the IV working? It's not infiltrated? All right. We're just going to take another minute to make sure she's sleepy. Any questions?
Yes, we have a question from Kieran on Facebook
Sure.
asking, how long will the disc take to heal after surgery?
It takes 9 months to a year for this right here to seal over. You can see that now that I've cleaned out the herniation, if the inside of this tube is about 5 millimeters, the laser fiber is 1 millimeter, you can see there's going to be about a 2 millimeter gap that needs to heal. So by the time we're done debriding, yeah, so you can see this thing must have been so painful for her for so long. Hold the tube too. I don't want it getting out of place. Okay. More important to hold the tube than the patient. Just be careful. She's a larger patient, so, you know, maybe she just needs a little more anesthetic. That said, we're almost done with this L5-S1 on the left side. We still have the right side to do. All right. Any questions?
At this moment, no current questions.
Just cannot rotate this thing for some reason. By the way, what I'm removing right here is herniated disc. It's just stuck within the annular tear from all the scar tissue, her body trying to get rid of it itself unsuccessfully. So when you watch our video on how we do the Deuk laser disc repair, we're debriding the annular tear. That's exactly where we are right now. And what happens is with chronic inflammation that goes on for months and years, is the body starts putting in scar tissue right here, but also scar tissue is easy to see. It's the white stuff. And then also calcium. Calcium's easy to see because it's gold color. When the laser hits it, it turns gold. But what you don't see, blood vessels, which you can see as pink color, right? Which we all saw earlier. But there's something that's invisible to the eye, and it's the actual thing that's responsible for all the pain, and that is nerve fibers. It's small little nerve fibers here inside the scar tissue and inflammatory tissue that is responsible for all the pain. All right, just about finished. I need about another minute to work on this last bit right here, and we'll be done. Wow, we're going to move on to the L4-5 next, and then we'll go to the other side. Laser on, please. And we're going to do the L5-S1 from the left. Sorry, from the right. I am on the left currently. Henry, we've shown the audience the DLDR versus other treatments that are invasive, that don't work.
We have not.
Oh, we have not. Okay.
We can most definitely, but we do have a comment from Timmy on YouTube.
Sure, I'll take it.
Saying, good talking with you the other day, Dr. Deuk. Can't wait to have my C4, 5, 5, 6, and C7, 6, 7 cleaned up someday soon.
Sounds good. Yeah, I'll be looking at your MRI later on today and taking a look at that cyst we're talking about. You know, people get cysts in the cervical spine. They're called neural cysts, perineural cysts. And perineural cysts never cause any symptoms at all. But I get a lot of questions about perineural cysts. And the other type of cyst we see in the spine is called a synovial cyst. The difference is a synovial cyst comes from the facet joint, F-A-C-E-T joint. It's an arthritic cyst. And the perineural cyst is just a cyst that's related to what's called the arachnoid or meninges. And neither of them cause any pain or symptoms typically, except in the lower back. If you have a gigantic synovial cyst, it can pinch your nerve. But in the neck, we never see that happen. We typically don't treat cysts in the neck because they don't cause any problems for the patient. And treating them could cause a big problem. All right, pressure here, and I'll take care of this. We're gonna get the next disc done, shot. Yeah, so our little wire here is bent, or the needle is bent, I should say. You can see the dilator there. That's actually on the other side, the patient's right side. Remember, I put the right dilator in 5-1 to open up the disc space so I can get the left dilator in at 5-1 and do the left side surgery. So it was actually an interesting technique that I've developed here at Deuk Spine of, figuring out whichever side you can get into when you're doing bilateral easier, and then using the dilator to open things up and make it easier. All right, we're going to do L4-5. This is the dilator. This is what it looks like. This is why our patients don't take any pain medication after the surgery. We don't need to give them narcotics. It's this device right here. What does this do? You see how it's kind of pointy, like a pencil? Okay, it slides down the guide wire and it spreads open the fascia, spreads open the muscle, spreads open all these tissues under the skin that are fibrous. You see, if I push it through here, it spreads open the fibers. My fingers are the muscle fibers or the fascia fibers. It doesn't cut them, it spreads them open. And that's why we're not cutting anything inside. That's why there's no pain afterwards. That's why there's no need for pain medication. That's why there's minimal bleeding and the patient recovers so quickly. This whole technique of endoscopic surgery, minimally invasive, is so amazing when it's done properly. Any other comments or questions?
Yes, we have a question from Daniel on YouTube.
Daniel, welcome.
Also saying, good talking with you the other day.
Thank you.
Can you give an explanation into the Deuk SI joint rhizotomy?
Yeah, sure. We'll do better than that. We'll even show you guys the video. So the Deuk SI joint rhizotomy is a patented procedure we developed here at Deuk Spine, where the SI joint, which is at the bottom of your spine, it transmits through the joint all the weight of your entire upper body through the right and left SI joint, down to your hip bone and your legs. So basically, all of the weight of your upper body goes through the L5-S1 disc, and then that S1 is the sacrum. It's a big bone. It's called the tailbone. That sacrum transmits the weight through the SI joints and down your legs. So the SI joints are weight-bearing joints, and like any other joint in your body, they can become injured through trauma, some kind of a fall or car accident. And then once they're injured, what you're injuring is the capsule. You're tearing it. The joint becomes very painful as the capsule tries to heal unsuccessfully, and you keep re-injuring it through movement. So basically, the SI joint becomes arthritic, causes back pain right over the tailbone. And we have developed a treatment that permanently cures SI joint pain called the Deuk plasma rhizotomy. Henry, let's show the audience how SI joint causes pain and how we fix it.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. So hopefully that answers your question about how the SI joint can be so painful, and how we fix it here at Deuk Spine using our patented procedure, the Deuk plasma rhizotomy. Okay, we are in the L4-5 disc on the left side. Look at that pink stuff. Remember I told you with inflammation you can see the blood vessels, which are pink, and there's lots of them. We call that capillary hyperemia or blush. You can also see, and these are not normal blood vessels, folks. When you have a herniated disc like this and your body's fighting it for years with inflammation attacking, causing your pain, what happens is you develop abnormal blood vessels. These are not normal. Like normally this part of your disc does not have blood vessels, okay? It shouldn't be here. So the fact that they're a pink color tells us that there's blood vessels, but the blood vessels are normally not found within the inner annulus fibrosus. They're only found in the outer half of the annulus fibrosus. So what causes the blood vessels to grow here is inflammation. Inflammation is a really complex set of processes that your body undergoes biochemically and physiologically, where you're basically producing chemicals called hormones, cytokines, which are signal messengers that cause cells to undergo physiological changes or biochemical changes. For example, you bring in, you make your capillaries leaky, they bring in neutrophils and macrophages, and those cells engage in the inflammatory response, in particular the neutrophils. Neutrophils release toxic enzymes that break up tissues. They're trying to remove the herniation for you. But instead of removing the herniation, all they do is create scar tissue and more damage. And this goes on and on for years and years because these herniations never go away on their own. Your body's trying to get rid of them, but it cannot. So there's a lot of misinformation out there on the internet and under AI even today where they believe that these herniations heal themselves. They don't. They never do. They just get better for a little while, and then you set it off again next time you push out another fragment of herniated nucleus into the annular tear, where it then wedges in and causes another cycle of inflammation. You guys can see the tear right there. That's the tear. I'm on it right now with the laser, and I'm debriding it. And that gold color right there is calcium, and that shouldn't be there either. Normally you don't get calcium in your annulus. The annulus is just collagen and elastin. So to get calcium like this, it takes chronic inflammation years to build up this calcium deposits. Just like it takes years and many millions of years for fossils to develop, these are like fossils you're seeing. Any questions?
At this moment, no current questions.
All right, so we're cleaning up the herniation, the blue stuff. That's the nucleus pulposus, and that's degenerated nucleus. Then you've got the white stuff, which is the annulus fibrosus right there, and the scar tissue and the calcium, which is gold. Once it hits with the laser, it mixes with the laser energy, turns gold color. You got little nerve fibers that are pain nerves that are being zapped away by the laser, thank God. That's what gets rid of the back pain. This is the only surgery in the world designed to cure your back pain, the Deuk laser disc repair, when it's coming from a disc injury, like a herniated disc, bulging disc, ruptured disc. This patient is actually an educator herself. She, I want to say, she's either the dean or assistant dean of a large university here in Florida. She did not want fusion surgery. She's already had the pain management doctors doing all kinds of shots and for her that didn't work. Maybe she's willing to share her testimonial after surgery tomorrow. We'll see. We'll talk to her. But we're almost done at 4-5, and then we're going to move on to the right side and fix the L5-S1 on the right. All right, Henry, have we shown the audience the 30 causes of back pain? I think we did.
Yes, we have. We have not shown the Deuk laser disc repair versus
other treatments.
Correct.
All right, let's do that.
Copy that.
Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. And welcome back. You've seen from our animation video there, or our video I should say, that we have 30 different causes of back pain, right, Henry?
That we do.
And that the most common is the disc. The
Correct.
disc, huh?
Correct.
Yeah, the disc accounts for 85% of people with debilitating back pain. The disc is the cause in 85% as the main cause. Now, the facet joints, the SI joint, the piriformis, they're all very common causes, but not even close to the disc. By the way, when you injure a disc, you also injure your facet joint. So whatever traumatic injury caused the disc injury, it's also going to cause a facet joint injury. The difference is the disc hurts more often. That's because, well, there's no real rhyme or reason, but the disc is the bearer of 85% of the weight going through your spine, 85%. The facet is the bearer of 15% of the weight. So maybe that has something to do with it. Maybe it's more just the pressure of the disc pushing down on that tear, causing more herniation and inflammation. That's my guess. I don't have any proof of that, but what I do have proof of, folks, is that the disc is the cause of back pain, as the main cause of back pain in 85% of patients with chronic back pain. So what is chronic back pain? Well, chronic means it's been going on for more than 2 weeks. There it is right there. You guys see that?
Yes, we do.
12 o'clock. There's that pocket of inflammatory tissue that's causing all of her pain when she's moving around every day. Right there. See all that little blood vessels? I'm going to go zap them away. We're going to say bye-bye to the pain. So, if you're watching from home, I want you to say, bye-bye back pain. Bye-bye back pain. Say it. You don't type it, just say it. And laugh along with us.
Bye-bye back pain.
Bye-bye back pain, Dr. Berndes says. All right. Any questions?
No current questions, but we do have a comment coming from Daniel once more on YouTube
All right, Daniel.
saying, thank you. Looking forward to seeing you soon to get rid of this pain.
I look forward, Daniel. Look forward to helping you get rid of your pain, my friend. All right, little pieces of herniation coming out. Some of them not wanting to come out, requiring me to spend some extra effort to get them out. But you can see we're looking straight down the tear. You can see the tear more to the right. Here's a piece of grungy old disc herniation that's been collagenized and calcified. This is very common when you have a herniation that's been causing problems for many, many years. By the way, if you want my advice, get your painful discs fixed at Deuk Spine Institute early, right away when you notice it. Don't wait years and years for your disc to degenerate and your life to be robbed from you. All right. Any other comments or questions?
At this moment, no current comments or questions.
All right. Again, I'm Dr. Ara Deukmedjian, CEO and founder. There's a piece of herniation right there that just doesn't want to come out from the deep. You guys see it?
Yes, we do.
Well, that's the beauty of endoscopic surgery. You can see everything. Yeah. Whereas with other surgeries like laminectomy, discectomy, you cannot see any of this because the surgeon's not inside. Look at all that inflammatory tissue, guys. That is where all this pain is coming from. It's like, I don't even know, it's like a serpent's nest or a spider sac, just full of painful material. Goodbye, pain. Goodbye, back pain. Adios, amigos. They're not really our amigos, though, are they? That's what happens when you have an Italian saying goodbye in Spanish. All right. Any questions?
At this moment, no current questions.
All right, we got about 3 minutes left. We're done. I'm at the last part of this tear. This is it. There's the outside of the disc. Now notice this side, the tear is bigger. This is the right side at 5-1. It's not as small as the left. And again, very painful for her. Right, Dr. B? Yes. But we're done, so I wouldn't.
From 60 to 86.
Heart rate just spiked up 26 points. Because, see, this is so painful, even though she's asleep, her heart rate still went up. Okay? That's because of the pain pathways that go to the brainstem, not the cortical areas. The cortical areas are shut down. Yeah, she's wiggling around. But we're done. We're done.
We just got 2 questions.
2 questions? Sure, why not?
First question from the classic Carnut on YouTube,
Classic Carnut.
asking Dr. Deuk, great work as usual.
Thank you.
What do you like to do during downtimes? Any hobbies?
Oh yeah, thank you for asking. I do love cars. I love like nice cars, but I don't really get into it. You know, they're expensive, and I don't have any space. But I do love plants, orchids. I'm really into orchids lately. For the last 2 years, I've been growing orchids in my yard. I like plants, specifically orchids, bromeliads, begonias, and Hoyas. But so I travel around. I go to gardens with my wife in different cities, and I kind of see what plants they have, and I'll identify them, and then if I really want one for my garden, I'll get it. That's kind of what I've been doing lately, is just gardening. It's good for me. I'm outside, fresh air. I get up early, get my day started early. So gardening is what I do. My kids are the other thing. They're both in college, and you know, helping them be successful, you know, doing well in life. You know how it is when you head off to college, or you know, when you're done with high school, you there's a lot to learn. So kids need their parents for that. We're done. We did 1/4-inch incisions on each side, and tomorrow we'll get her staples out. She'll go off and live life and enjoy life, okay? But this procedure is 99.6% cure. That's with 5,000 of our patients. We interviewed them, asked them afterwards, how much of your pain did we get rid of? The answer was 100%, 100%, 100%. And then once in a while we get a 95. So the average is over 5,000 patients that had this laser procedure. I'm sorry, not 5,000, I apologize. The answer is over 500 patients that had this laser procedure. And we've had more than 2,700 patients have it, but the 500 we asked that we did our study on, the average was 99.6%, and that was durable. It lasted. We even looked at over 100 patients that were 6 years since they had their surgery, and the average pain relief was 92%. So this is a great surgery that works. We don't put any implants in your spine or body. It's outpatient, no bleeding. It's safe, no pain meds afterwards. They go home and go back to a normal life very quickly. Patients love it.
And then lastly, we have one more question coming from Professor on YouTube.
Hello, Professor. Welcome.
Asking who designed and made these precision tools?
Well, the tools that I'm using right here were made by a company called Richard Wolf. Richard Wolf is out of Germany. They make spinal endoscopic equipment, and that's who designed and made these precision tools. The laser, on the other hand, is a medical laser, FDA approved. It's made in Israel. And we use a luminous laser. It's a very special laser. So I hope that answers your question.
And that is it for questions.
All right, we'll see you all next week on Tuesday. Thanks for joining us. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. I have a patient with me who just had the Deuk laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year, I'd say close to 5 or 6 months. It's one day after and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Deuk Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
you had, was it back and leg pain, correct?
Back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a micro discectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
so
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Deuk Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.